One of the great things about the GU team here is that a lot of us are involved on a national level on creating the guidelines of care, doing the research and then being involved in the panels and decision-making that set up what standard of care is for the cancers that we treat.
The people I work with are national and international leaders in genitourinary malignancies. I mean, they write the textbooks, they write the papers, they do the research that sort of moves the field forward.
For me, it's a privilege that I get to work with people who are experts in prostate medical oncology and prostate surgery.
As a urologic oncology group, we do over 1,000 complex urologic cancer cases a year, which is really a tremendous volume. Everything from very routine cases to very, very, very complex cases.
Prostate cancer is the most common cancer in men, with nearly 200,000 cases diagnosed in the U.S. each year. Fortunately, most prostate cancer is discovered when it hasn't spread and is still confined to the prostate.
For patients who have low-risk disease, there is a really great opportunity to forgo treatment and to go what's called active surveillance.
Active surveillance is an option for some men whose prostate cancer is growing slowly, or for those whose cancer is unlikely to cause complications. This process involves actively monitoring the cancer and only starting treatment if the cancer becomes more aggressive. Doctors may recommend active surveillance because it allows patients to avoid or delay the side effects of treatment, although not every patient chooses this course of action.
The most important decision, I believe, when you first are told you have cancer is to figure out where you need to be treated and where you need to be seen. At a comprehensive cancer center, you can get multiple opinions from different people, such as surgeons, radiation oncologists, medical oncologists, pathologists, radiologists. And all of that comes together to give you the best option.
So prostate cancer care is incredibly nuanced. This is where a center like Fox Chase comes in. The pathology, the biopsies need to really be examined by world-class pathologists to make sure that the disease that was diagnosed is appropriately categorized.
Treatment options for prostate cancer can vary from patient to patient. At Fox Chase, we work with you to determine the best course of action. In some cases, surgery will be your best option.
When it comes to prostate removal or the surgical management of various cancers, our philosophy that we establish as a team, the first is a safe operation. The second is curing the cancer. And then the third is if we can do that safely with a robot, with a laparoscope, with a new technology, and the quality of life is improved, that's a home run.
We really developed a special practice in minimally invasive surgery. We've been doing robot-assisted surgery for more than 10 years here.
Robotic surgery, meaning using the robot to remove the organ. It affords you smaller incisions, quicker recovery time.
My patients after this operation have had an excellent recovery of their urinary function and their sexual function, and that's really to a huge benefit for the patients.
One of the nice parts of working at Fox Chase Cancer Center is the fact that the urologists work well with the radiation oncologists and the medical oncologists and really provide a team approach to taking care of the patients.
Where we're figuring out how to thread that needle a little bit better. When do we actually do surgery? When do we do a medical therapy? When do we do radiation therapy? And how to combine those when that's needed.
When I'm developing my treatment recommendations for a patient, I've had the opportunity to speak to the other physicians that day. So they've not only gotten recommendations from me, but from my partners in the Department of Surgery, as well as radiation oncology, radiology, pathology, and medical oncology.
Radiation therapy uses high-energy radiation to shrink tumors and destroy cancer cells.
I'm a radiation oncologist who specializes in the treatment of both prostate cancer and bladder cancer. And today we have so many different ways of treating these different cancers. We can use external beam radiation. We have intensity modulated radiation therapy. We have the ability now to give shorter courses of treatment. So over the years, I've treated thousands of men with prostate cancer.
Fox Chase, in particular the Department of Radiation Oncology, has been a leader in the field with developing new treatments and new ways to deliver treatments, give our patients a lot of new treatment options that aren't otherwise available.
It used to be that most every man would go through about 7 to 8 weeks of daily radiation. What we found is there are some disease processes that we can manage in as little as 5 weeks, some maybe even in 2.5 weeks. Now, by increasing the dose of radiation that we give each day in select patients, taking into account their needs and realizing that you don't have to take 2 months out of your life to do this, we may be able to do this in as little as 2 weeks.
We really do a lot of high-dose rate brachytherapy for prostate cancers. We implant the radiation source into the tissue and deliver radiation therapy from the inside out. Men that receive brachytherapy really do well and are very pleased with that.
For patients whose prostate cancer has spread beyond a confined area, or patients who have high-risk localized disease, medical oncologists at Fox Chase employ some of the latest systemic therapies. These include chemotherapy, immunotherapy, targeted therapy, and hormone therapy.
For prostate cancer, it's really our job to pinpoint which area of the spectrum each man is at with prostate cancer, and then select from a wide variety of treatments which makes the most sense.
Men with prostate cancer have new treatments available that weren't available 3 or 4 years ago, and many of them can live a very normal lives for many years.
We use hormonally acting treatments, chemotherapeutics, immunotherapy, and all of this in conjunction with both surgery and radiation to give our patients the best chance at the longest and best quality of life with prostate cancer.
One of the most exciting areas has really been the advent of immunotherapy and using them to allow the patient's own immune system to act against the cancer. And that's a great way to treat patients because it can often allow for less side effects and toxicities that we've seen with prior therapies that we've used.
In addition to the latest treatments for prostate cancer, Fox Chase has an active and widely respected clinical trials program. Our doctors and researchers are developing and evaluating a number of new therapies.
I will always believe in trying to do better and to doing that through clinical trials.
Coming to a place like this where it's bursting with innovation, bursting with new ideas, it can be sometimes a huge game changer for patients. This place often can offer them something that nobody else can.
Together, we're actually creating some of those newer techniques and newer technology that will make a difference in our patients' lives.
You know, patients that honestly I wasn't expecting to be alive just, 6, 7 years ago are still coming in. They're still rocking their grandkids on their laps, and we're keeping them healthy and we're keeping them strong. So it's a really exciting time in oncology.
We are a world-class cancer center, but we're very approachable at the same time. The patients really feel that there's, on a personal level, that they're really getting one-on-one treatment and one-on-one care, which I think they really are, and that's unique to Fox Chase.
To learn more about Fox Chase's multidisciplinary treatment options for prostate cancer, contact us today at 888-FOX-CHASE or visit foxchase.org.